More than 400,000 knee surgeries are performed every single year. Traditionally, the operation requires a long and painful recovery period, but now a new procedure is making it much easier for patients to take the leap. CBS News correspondent Cynthia Bowers reports.
I'm going to tell you what to expect for the surgery.
For Linda O'Brien, a grandmother and scratch golfer, chronic knee pain was making life unbearable.
It weighs on you and it becomes depressing. It affects your whole life.
Linda first hurt her knee in her 20s, and for the next 30 years, her many activities only made it worse.
I still play golf, you know, and get by okay, but over time, it's just checking off one more activity that I can't do.
This is Linda's x-rays.
Help for Linda finally arrived in a new kind of knee surgery developed and perfected at Chicago's Rush University Medical Center by Dr. Richard Berger. Traditional knee surgery cuts through muscles and tendons, while the new surgery simply moves them to the side in order to fit the knee with titanium and plastic caps, creating a knee joint free of pain and arthritis.
With this kind of surgery, we don't cut into the muscle at all, and therefore the physical therapy is easy to do, and it's quick, and it's not very painful for them at all.
When he says quick, he means it. Dr. Berger estimates Linda will spend just a few hours in the hospital after surgery before she's well enough to go home.
The speed with which this all is happening kind of makes this like drive-through surgery.
It really is. Patients come in the morning of surgery, have the surgery, and then go home that afternoon.
Hi everybody from the Boulders, my ladies mountain golf team. I'll be ready when this is over.
Doctors numb the lower half of Linda's body, and surgery begins a little after 7 a.m. Her knee is wrapped in tourniquets and antibiotic plastic to cut down on bleeding and the possibility of infection.
Then what we're going to do is we're going to make a small incision, but more important than that, we're not going to violate the muscles and the tendons. She's got a lot of scar tissue from her multiple previous surgeries.
Scar tissue and arthritis are removed before she's fitted with the prostheses, which will act as her new knee.
Metal will be on plastic, and ultimately this is how the knee is going to work.
Less than 2 hours later, the operation is over.
You know what? I'll be chipping and putting in 3 weeks, maybe 4.
After a mere 5 hours of recovery,
Linda, how do you feel?
I feel great.
I cannot believe you've just come out of surgery. You look terrific.
Well, thank you.
But looking good isn't enough. The very day of surgery, Dr. Berger has his patients conquer what amounts to a knee-bending obstacle course, all before they're able to leave. Walking up and down a hallway.
Isn't that good?
Yes, I can't believe it.
Pretty amazing, huh?
Yes.
And up and down a flight of stairs.
Now, the one we operated on is going to go down first.
I'm going to cry again.
It's okay, you can cry. You can cry, it's okay.
Until doctor and patient are satisfied that the knee works and she's ready to go home.
It's wonderful. It really is.
Are you having any pain or discomfort?
No.
Good. Isn't that amazing? Good.
It is amazing.
For The Early Show, Cynthia Bowers, CBS News, Chicago.
Good.
And just 2.5 weeks after her surgery, we are joined by Linda O'Brien. Good morning, Linda.
Good morning, Julie.
You look fabulous. How does your knee feel?
It feels very good. I'm very excited, and hopefully I'll get out here today and play 9 or 18 holes.
Now, your doctor knows that we have you out there at the Pointo Woods golf course this morning, right?
Yes, he does.
Okay. Now, when you were on the surgery table, you talked about chipping and putting in about 3 or 4 weeks. But I understand you're going to drive the ball for us this morning. Have you been driving balls out on the golf course yet?
Actually, yesterday I hit my first drive, and so today will be the second day I do that.
You want to do it now?
Sure.
Let's see. I'm going to call you Scratch because people need to know your handicap is 11. So Scratch, go for it.
Thank you.
Very nice. Great form. How does that knee feel?
It's the first time that I've not had pain in my knee in over 25 years when hitting a golf ball, so it feels fantastic.
All right. I have 2 seconds left. Is your game going to improve because of the surgery now?
Absolutely.
Linda
I'm
O'Brien,
ready to go.
congratulations. You look great.
Thank you, Julie.
We're back after this.